If you're recovering from knee surgery, one of the biggest challenges can be regaining full knee flexion. In this video, we'll be going over how to assess your knee flexion, step-by-step progressions to improving knee flexion, and key exercises to get you back to a full range of motion. Before we get into exercises, let's assess your knee flexion. There are two simple ways to do this. Option 1, you're going to lay on your back with both legs extended. Slowly bend your knee, bringing your heel closer to your butt. Use your hands or a towel to gently assist. Only go as far as you can comfortably go. Compare it to your other knee. If your heel doesn't come close, that's okay. We'll work on it. Option 2, you're going to do a quadruped rock back. So for a quadruped rock back, this is a little bit more compression through the knee. So if this bothers you, go back to the first option. So you're going to get on your hands and knees and slowly rock your hips back toward your heels. Keep your spine in neutral. Stop when you feel resistance or discomfort. Check how close you can get to sitting fully back on your heels. Full knee flexion is about 135 degrees, meaning your heel should ideally touch or come very close to your butt. If it doesn't, let's go through exercises to improve that. One of the best ways to ease into knee flexion is using a stationary bike. Here's how to do it properly. Step 1, adjust the seat high enough that you can just reach the pedals without over bending your knee. Begin by rocking the pedals back and forth. Don't force full rotations yet. I like the Airdyne specifically because I can use my hands to control the force that goes through my knee. As your knee loosens up, attempt a full pedal stroke. If you feel pain, stop at a comfortable range. Step 4, gradually lower the seat over time to challenge your flexion more. Try cycling for 5 to 10 minutes, 2 to 3 times a day. This gentle movement helps lubricate the joint and improve range without excessive strain. If you don't have access to a bike, heel slides are a great alternative. For this exercise, you're going to sit on the floor or lay on your back with both legs extended. Place a towel or slider or just sock on a slippery surface under your foot for easier movement. Slowly slide your heel toward your butt as far as you comfortably can. Hold for 3 to 5 seconds, then slowly extend the leg back out. If you need more of a stretch, use a towel or band to assist by pulling your foot towards you. Perform 10 to 15 reps, 2 to 3 times a day. Keep the movements slow and controlled and avoid forcing past pain. As your mobility improves, you can start adding kneeling progressions to help deepen that knee flexion. I would start with a quadruped rock back. For these, you're going to start on all fours, keep your back straight, rock your hips toward your heels while maintaining a neutral spine. Pause, then return forward. If this is too intense, place a towel in the crease of your knee to reduce pressure. Once rockbacks feel comfortable, you can move to tall kneeling rockbacks, where you try to sit back onto your heels with a more upright torso. If you can't yet, hold onto a stable surface for support. You can also try half kneeling position, which targets one knee at a time. Once you have better mobility, it's time to build strength in these new ranges. Here's how to squat safely. First, start with an assisted squat. Hold on to a TRX, squat rack, or sturdy surface. Lower into a squat as deep as comfortable. Let your knees travel forward slightly, keeping your heels down. From assisted squats, we're going to move to heel elevated squats, where we place your heels on small wedges or plates. This shifts more weight forward, making it easier to get deeper into that knee flexion. Focus on lowering as far as possible without pain, holding the bottom position briefly. Start with 6 to 10 reps and progress as tolerated. Most of these exercises work on knee flexion with the hip bent, but it's also important to train flexion with the hip extended. For this, we're going to move into the dynamic coach stretch. We're going to set up in a lunge position with your back foot elevated on a coach or bench. Squeeze your glutes and think about tucking your tail if you had one. And gently rock back to your butt back towards your heel, increasing the stretch. Hold for 20 to 30 seconds, or you can oscillate in and out of that end range. If kneeling is too uncomfortable, try a split squat with your back foot on a low bench. Lower into the squat, keeping control and focusing on a full stretch in the back leg. You can use the wall or a stick, like in this video, to help with your balance. These exercises help balance knee flexion across different positions. To summarize, regaining full knee flexion should be a priority after surgery. Start with a stationary bike or heel slides and progress to kneeling and squatting variations as tolerated. Move within a comfortable range, avoid excessive pain, and be patient. Progress takes time. Good luck and thanks for watching. If you find this helpful, hit the like button and subscribe. And if you have any questions, drop them below in the comments. And I'll see you in the next video.